come to the high point, the keynote speech for tonight. Thank you very much for being with us, Dr. Francesca McCartney. She is founder and president of the Academy of Intuition Medicine in California in the United States. Thank you so much for being with us tonight. Since 1976, Dr. McCartney has worked in the field of intuition as a medical intuitive and an integrative health clinic, a spiritual counselor, author, and educator. In 1984, Francesca founded the Academy of Intuition Medicine in Mill Valley, California, United States. Francesca synthesizes her decades of study in Eastern and Western spiritual healing arts into an inclusive approach which respects both the inherent uniqueness of the individual and the commonalities that bind us all together. From her pastoral counseling and medical intuitive work with thousands of clients, Francesca developed the Intuition Medicine curriculum. Dr. McCartney is an inaugural recipient of dual PhD in Intuition Medicine and Energy Medicine. Francesca, it's so great to have you here tonight. All the best to California. The floor is yours. Thank you so much. The mute button.
Okay, thank you, Markus, and good morning from California. I am Francesca McCartney, and as Markus said, I am the founder and director of the Academy of Intuition Medicine in California. I founded the Academy in 1984. We have both a campus school in Sausalito, which is near San Francisco, and we have an online school where we teach students the same curriculum globally, and we have students online in 30 countries. The mission of the Academy is to train students in expanding their innate sense of intuition so that they can integrate it into their current career or develop a career as a medical intuitive. When we admit our students, we give them an assessment test to determine which intuitive senses are developed, which are dormant. And there are multiple ways that you can experience intuition, more than Aristotle's concept of only 5 human senses. And research over the past 100 years has shown that humans can experience more than 21 senses. So we begin with our student assessment with a list of some of the more usual intuitive perceptions. And I'm going to go through that list with you, give you the definition, and give you descriptions of how that intuitive perception can be experienced. So I'm going to start with the clairs. The first intuitive perception is clairvoyance, and that means clear seeing. And clairvoyance is an intuitive perception whereby a person can look at and scan another human being and perceive the subtle energy field around their body or through their body. Usually that's called the auric field. Now, in 1994, one of our faculty, Dr. Beverly Rubik, was doing a research project at the National Institute of Health in the United States. And her team determined that they could measure the biofield, and she actually coined that term, biofield, or the subtle energy field of the human body, and measure it in a way where it could be placed and it could be determined if it was a healthy biofield or an unhealthy biofield. So clairvoyance for most people is usually a quick hit, which means you may look at a person or you may look at an object even and get a quick hit of a color or a pattern or a visual. Most people don't have clairvoyance as a sense that is continually giving them information. The next clair is clairaudience. That means clear hearing, clear hearing. And most of our students experience clairaudience from hearing the voice of a deceased loved one calling out their name. That's what's been reported the most from our student body. Clairaudience means hearing sound or music or a voice, just as you're hearing my voice, not a silent voice in your head, but an audio voice. That's very clear. The next clair is clairsentience. That means clear feeling. And here's an example of how clairsentience operates. You can be out to lunch with a friend and you're in a great, happy mood. Your friend is depressed and sad. And as you listen to your friend's sad story, you start to feel depressed. You start to feel sad. You go home, you cry. You don't want to talk to anyone. That's called clairsentience. It operates like emotional radar in humans, whereby you pick up and feel other people's emotions. In psychology, that's called empathy. And there has been a branch of psychology that studies empathy in highly sensitive people. In Buddhist thought, clairsentience is called unmitigated communion, or in Western terms, it would be called burnout. And the unmitigated communion or burnout part of empathy, clairsentience, is when a person's body takes on too much of another's emotions and feelings, and they start to not feel their own feelings and disassociate with their sense of who they are. So there's a strength and a weakness, or a liability to being overly clairsentient. Actually, with most of these intuitive perceptions, there is a strength that creates a more humanness to you. And there are also liabilities when you get overwhelmed by all of this input, sensorial input from the world around you. One of my colleagues, Dr. Robert John at Princeton University, noted in his research that humans experience more than 5 billion hits of perception a minute. And if we did not have human perceptual filters, we would go insane in 1 minute. The next clair is clairaudience, and that means clear smelling. That one, most of my students, or the lowest percentage of my students, report clairaudience is developed. And also, when we take our students through this list, this assessment list of intuitive perceptions, we ask students to chart as they're progressing through the training, which of these intuitive senses are developed when they enter the program, and which they would like to develop. And then at the end of the program, which is a 2-year plus program, which of these senses has come online and they are using as one of their common senses. So back to clairaudience. Not many of our students have that developed. It means clear smelling. However, the highest majority of students who report they have an active clairaudience are chefs, are people in the food industry, where they can smell food, herbs, spices when those objects are not even around them. Coupled with clairaudience is clairgustance, clear tasting. And again, it is not a developed sense in most of our students, unless students are in the food industry. They're cooks, they're chefs, and clairgustance means you can taste a food or a spice or a botanical when it is not actually in your mouth. So clairaudience, clear smelling, and clairgustance, clear tasting, often work in combination. Now, with human senses, well, let's call them the 5 common senses, often work in combination. And that same theme operates with intuitive perceptions, that usually you are picking up intuitively information in combination with other senses. So for instance, clairaudience and clairgustance usually operate in combination. Here's an example with the 5 common senses. When you eat chocolate cake, you usually often look at it first, so you're using ocular vision. You smell it, you're using your sense of smell. You taste it, and you, if you chew loudly, you can hear yourself eating the chocolate cake. So that's using all of your common senses in combination. And that same concept operates with your intuitive perceptions. The next claircognizance. That means clear knowing. Most people operate with a clear knowing. And knowing means just getting a quick hit, a quick awareness that you know something. Maybe you haven't studied it, you haven't taken a class, no one has told you about that subject, but you get a clear, quick hit of knowing. Now, in our training program, when students come in with a heightened knowing, we advise them and train them to trust that intuitive hit, trust that knowing, follow through, and use it. If the trusting and following through is not utilized, then often the knowing does not become fully developed or does not download into the human senses very readily. So claircognizance is often coupled with inner voice. And inner voice is hearing your own wisdom voice, your inner voice, not listening to the other voices that you may hear in your head, but listening to your own inner awareness voice giving you information. So those 2 senses are often used in combination, knowing and listening to your inner voice. So telepathy is another human sense that many people experience. And telepathy is it's also a combination. Telepathy is receiving information from another person in an unspoken manner. Here's an example. Your phone rings, you usually don't pick your phone up, but you get the mental communication that, hello, this is your best friend, pick the phone up. And you pick the phone up and it is your best friend. Well, that friend has telepathically, like transmission in email and telegraph messages, has sent you a message, hello, pick your phone up. Often students in our school report that they have very active telepathy. Psychometry. Psychometry is using one's hands or your full body in detecting energy and information from another person. Often psychometry is active in people who touch bodies as their career in the medical profession, in physical therapy, in professional body workers. They report that they can put their hands on a person's body and detect what is going on with that person. An illness or a disease often gets picked up through the hands, and hands are quite sensitive for detecting subtle energy. we teach our students from the very first class how to use psychometry to scan a subtle energy field and to begin to develop their psychometry by picking up strong and weak biofield senses. And this goes back to Dr. Rubrick's experimentation at the National Institute of Health. She used machines to measure the subtle energy field. And in our academy, we train our students to use their entire body and specifically their hands as measurement instruments of subtle energy to determine strong and weak human frequencies, and also to develop their sense as a medical intuitive to use their psychometry and their clairvoyance and their clairsentience in combination to assess a person's health. That's more or less a definition of a medical intuitive. In the 1970s, I was in training at the Academy of Eastern Medicine, a alternative and holistic medical clinic here in California. I was brought on the faculty as a meditation instructor. And as I developed the patient's innate abilities to quiet their mind and to develop a positive thinking, that was a prescription that the clinic doctor would give to many of his patients to practice meditation as part of their regimen instead of giving them medication. Primarily, he asked me to come on board and teach meditation to his patients who had high blood pressure, because he believed if a patient with high blood pressure could calm their mind and their body and move into a positive mental state, that their high blood pressure would be reduced. Well, that was the 1970s, and now we're in 2020, and that has been proved over and over again that meditation and quieting your mind does lower blood pressure and many other illnesses that have origins that are more psychological than physical. And as I developed this process of meditation as a prescription for patients, I also began to develop the heightened perception of being a medical intuitive. As I was operating in this medical clinic, I would go on rounds with the doctor, and I learned as a layperson Ayurvedic medicine, botanical medicine, chelation therapy processes, how to do an assessment for nutritional therapy, homeopathy, and color therapy, and a range of other holistic therapies. And within that process of learning and observing, I began to develop my medical intuition perceptions, mostly clairvoyance, because I'm a highly clairvoyant person, where I would scan one of the patients in the clinic energetically, clairvoyantly, and psychometrically, and I would assess what illness was either pending or was about to become an illness for a person. And one of the positive aspects of being trained as a medical intuitive is it is a preventive medicine detection, where you can preview a possible illness in a person before that illness becomes physical, mental, or psychological. Lucid dreams. There is an institute in the United States called the RHIA Research Institute. And since the 1920s, the RHIA Institute has been researching lucid dreams and out-of-body experiences. Now, most of us have out-of-body experiences, but most of us don't call them out-of-body experiences. When you go to sleep at night, your body's asleep, your mental faculties are mostly turned off, and what can occur is your spirit body, your energy body, leaves your physical body and has experiences, out-of-the-body experiences. And at the Rhine Research Institute, there was a great deal of research done on how to stimulate out-of-body experiences and to codify them as to what occurs in the brain, in the physiology, and how much of that out-of-body experience can be recalled and brought into consciousness. And the research has been used in many different aspects of psychological and sensory, extrasensory perception testing. In 1999, I did an experiment at the Institute of Noetic Sciences here in California, where I tested with a group of 100 test subjects in a Ganzfeld box. And a Ganzfeld box is a sensory deprivation room that was developed to turn off the 5 common senses. It's completely black. There's no light. There's no sound. There's no kind of ambient stimulation. And the test that I ran was to have healing energy sent from the Ganzfeld box over the internet to 100 test subjects, and to have those test subjects respond by describing the energy they received and when they received it. We had high results of positive reception of that. So that's lucid dreams and out-of-body experiences. Then there's abstract intuition. And abstract intuition is understanding something as a whole. Often you get just a rote of information when you are studying something or you inquire about a formula, and it just simply comes to you as a whole rather than pieces that you have to put together. It's often reported by mathematicians in problem solving. They just simply at once get a whole rote understanding of a mathematical formula without having to break it down from beginning to end. A lot of inventions are created using abstract intuition. One story I remember from Einstein's biography is that he would often take naps and he would wake up with an invention fully formed in his consciousness. So that's abstract intuition. Precognition. That is knowing something before it occurs. And that could be knowing something tomorrow, the next day, or a year from now. Often precognition is a waking intuitive perception, but it's also a dream perception. Often people report that in their dreams, they have precognitive information come to them. They lucidly remember it in the morning. They note it in their journals. The best lucid dreamers always keep a journal next to their bed. And then they find that the precognitive dream comes to fruition on the timetable that was described in their lucid dream. So precognition is either awake or asleep. Remote viewing. That's a fun and interesting intuitive perception. Remote viewing is distance clairvoyance. So again, clairvoyance is clear seeing, perceiving energy field, auric field around the human body. But remote viewing is distance clairvoyance. Now, in the 1950s, the United States CIA created a remote viewing training program where they trained highly sensitive, highly intuitive people to be spies. And more specifically, in the 1950s, when the Cold War between Russia and the United States was going on, they used these remote viewers to spy on Russia. In the 1970s, colleagues of mine who were professors at Stanford University in California in the parapsychology department were recruited by the CIA to enter their training program for remote viewers and become spies. And there's a lot of books that talk about this era in the United States. There was even a Hollywood movie made about remote viewers in the CIA called Men Who Stare at Goats, with George Clooney as the primary actor. Telekinesis. Not often do I have students who report that their telekinesis is active. Telekinesis is moving objects with mental thought. And in the 1970s, there was a Russian researcher, Uri Geller, who demonstrated quite effectively that he could bend spoons with telekinesis, with his mind alone. I do have colleagues who have been in training to bend spoons, and much to their kind of surprise, these are academic colleagues, were able to bend a spoon. So that's telekinesis. Intentionality. Energy follows your thoughts. And most of our students realize that their thoughts have a potent and direct effect on how they live their life. When they're thinking positive thoughts, positive things occur in their life. When they're thinking unhappy or negative thoughts, that follows through into their life, often creating much havoc. So we train our students in positive thinking, and that whatever they're thinking, their energy in their life will follow those thoughts. Synchronicity. I like to use Carl Jung's definition of synchronicity: improbable, meaningful coincidence. And synchronicity is, in my research and my experience, a way to validate, verify for yourself when you have many or multiple occurrences of synchronicity in your life, is a way for you to verify that you're operating beyond the 5 common senses and that you are perceiving in a nonlinear way occurrences that are interconnected in a subtle, nonlinear, non-local perceptual state. So synchronicity. Deja vu. Often people have deja vu experiences, which means, here's an example. You are meeting someone for the first time in a conscious state, and you have a flash, you have a knowing, you have a clairvoyance. Oh, I've been here before, I've met this person before, this is very, very familiar to me. Or you visit a country that you've never been to before, and all of a sudden you have a deja vu. This is so familiar. I feel like I've been here before. My research and observation on the intuitive perception of deja vu is that there is a deconstruction of linear time and space and non-local perception where, as Einstein said, everything is happening all at the same time. Non-local perception is perceived, and there's a crack in your perceptual consciousness for a moment. Past life recall. There is a great deal of research, gold standard research, that has been done at the University of Virginia with Professor Ian Stevenson, psychiatrist. For 22 years, he did research on past life recall in children from around the world and different cultures. His medical colleague, Dr. Walter Semke, who is on our faculty, has continued the research of children with past lives and has written 2 or 3 books about his research. Dr. Walter presents his research yearly at our academy, and in March he's going to present a Zoom online presentation on how children's validated past life memories can help create a more peaceful life. So if you're interested in that type of research, it will be happening in March of 2020. I have gone through most of our significant intuitive perceptions, Markus. So if there are questions or comments, I'm open to that.
Francesca, thank you so much. Thank you so much from California. I know that Professor Fati is listening, Professor Paliskiewicz, lots of professors who love your speech, Tanja Schindelin, who spoke before, Professor Harteis, Bianca, Steffen, and thank you so much for being with us tonight. All the best to California.